Hi, Jonathan. I am so excited about our podcast today.
I am
Do you
also.
know why? Do you know why I'm
Why,
excited?
why, why, why are you excited?
You know how every episode we keep telling our guests, keep this as if you're talking to somebody who is a non-insider, right?
Right.
Stay away from the jargon. Keep it as accessible as possible. But I'm kind of excited about getting into the science a little bit. I mean, we got to put your knowledge to work, and we have a scientist, a fellow scientist like you on the podcast today. So I'm excited to get into it. I want to learn all about methods and modes of action. I want to learn about innovation, technology, and science. So Jonathan, why are you excited about today's topic?
Yeah, I'm really excited. Maria Ryan, she's a force in the industry. She's at the clinical head of Colgate, the multinational, the largest 200 years old oral health company. And they do great things. They do think really innovative. They're the kind of company that, when you're around 200 years, you know how important the people are, the people side of the equation. I'm really excited also to dig into, Maria Ryan is a researcher, scientist background, academic, and also is living now in large corporation and navigating that world. Really exciting to dive into, this siloing between medicine and dentistry, and how do we break down the walls, and what's Colgate doing about it? Because they are doing some great things. I think it's going to be a lot of fun.
I can't wait. Let's get to it.
Let's get to it. All right.
Hi, everyone, and welcome to another exciting episode of the Think Oral Health podcast. As usual, I'm joined by my co-host, Dr. Jonathan Levine, and we are privileged to have an amazing visionary and a leader joining us today. We are speaking with Dr. Maria Ryan, she's the Chief Clinical Officer at the Colgate-Palmolive company. She leads dental and dermal clinical organizations, knowledge management, and scientific communications teams. Maria is an accomplished leader and, as I said, a creative visionary. She served as a professor and chair of the Department of Oral Biology and Pathology at Stony Brook. She was the past president of the American Association for Dental, Oral, and Craniofacial Research. She's received numerous awards. And I'd love to acknowledge her award around the NIH National Research Service Award and the Physician Scientist Award. As I said, she's a visionary, she's a creative problem solver, she's a troublemaker, but she comes at it from a perspective of evidence-based science. And that's what we love about Maria. We love the energy that she brings into the conversations. And we love the topics that Maria loves to talk about. The importance of oral health as part of overall health, and also the role that the dental practitioners can play in delivering care. So these are only some of the topics that we will cover today. I am so privileged to welcome Maria Ryan to our podcast. Welcome, Maria.
Thank you, Maria and Jonathan, for having me on your podcast. It's exciting for me to be here with you.
No, it's great to have you here, Maria. Let's open it up a little bit with the question of Colgate has been around for many years, a leader in
over 200 years, Jonathan.
Well, to be exact, over 200 years. How do you keep it fresh? You're the chief scientific officer. Innovation is the energy of the day. How does Colgate keep it new, exciting, refreshed, reinvented in today's world?
Yeah, Jonathan, it's our purpose, really. Reimagining a healthier future for all people, their pets, and our planet. And when we talk about all people, it is in the areas of oral care. We're the leader in oral care, and Maria mentioned the work that we're doing in skin health and personal care, which certainly during COVID, we worked with the WHO to ensure that people use the proper mitigation strategies. I would say the innovation that we look for is, the 4 Ps that really move forward precision medicine and applying it to oral care, which is to be preventive, which we have always been the leader in prevention, and we continue to innovate in that area, to be predictive, to be personalized, and to have people participate more in their care. So people to be more participatory. And so these are areas that we are focusing a lot of our efforts, Jonathan, to really move forward with innovations in our company.
Love that. And there will be a quiz on the 4 Ps. So please, those of us listening, or our listeners. Maria, let's double click on the prevention part. There's the most, as Jonathan and I talk a lot about, the most widely spread preventable chronic disease, caries, is still a topic of discussion. We still use pretty crude treatment methods like a filling for that disease. So what are you doing in the area of prevention around caries? And I would lean on Dr. Jonathan Levine here as well to dig into that topic a little bit.
Sure. Well, of course, fluoride has been our standard of care for many, many years. It does help in preventing caries, and the studies show that fluoride can reduce risk of developing caries by about 25%, right? And all over the world, we see fluoride used in different levels in different countries. And professionally, we use high doses of fluoride in higher risk individuals. And, we have many, many products on the professional side and the consumer side. But clearly, as you mentioned, caries still remains a very, very significant issue. So we have continued to look into, what else can be done. And since the 1960s, our solution to prevention of caries has been solely based on fluoride treatments. And so we have come to recognize that there is a natural protective agent in saliva to help prevent caries. And that is an amino acid called arginine. And in fact, in people who have a lot of cavities, their levels of arginine in the saliva are very low. And in people who don't have cavities, their arginine levels are much higher. And even if you look in, we talk about companion animals, we have Hill's pet food and nutrition, etc. Many of us know that our dogs can get periodontal disease, but they don't get cavities. And we now know that in the saliva of a dog, they have very, very high arginine levels. So even in our companion animals, we see that arginine plays a major role in prevention of caries. So we have a number of products which we have developed, some containing arginine and fluoride, some with arginine alone. And we have now initiated studies in the U.S. We have a 9-center study where we are looking at the impact of arginine alone in caries prevention. And last year at the International Association for Dental Research meeting in Colombia, we presented the results of a study in 6,000 kids in China, where we were able to show that arginine was equivalent to, if not better, based on some of the higher doses of it, than 1450 ppm fluoride. So this is not to say we should replace fluoride, but we now have another active, which is very exciting. Just like you had aspirin before, and then you had Tylenol, and then you had Motrin, and then you had Naprosyn. Well, and all of these things can be used separately, together, to, address pain. We have now in dentistry a new active, which we have shown in studies can reduce caries risk by 50% when you combine it with fluoride. And we know it's at least as good as fluoride when used alone. So it's very exciting. That's very exciting on the preventive strategy.
But Maria, as an amino acid, so it's so fascinating as an amino acid. What are you considering, and what are the scientists like yourself considering as the mode of action? and how is that synergistic effect potentially with fluoride occurring as you think about this, or from the science that is getting eliminated?
Yeah, Jonathan, we actually had a special issue in the Journal of the American Dental Association, which goes into the mode of action, which has been studied for many years by many great scientists at Stony Brook, where I came from, at the University of Florida, Bob Burney, who was funded by the NIH, by our scientists at Colgate. And we know that fluoride strengthens the tooth, right? So it makes it harder, it makes it more resistant to the acids that break down the tooth structure. So that's how fluoride works. Arginine actually works by modulating the bacteria around the teeth. And what we know is that with time, so everyone is born really without those bacteria that will cause caries. And with time, you have a change from those protective bacteria, because there are actually good bacteria there, we call them the commensals, to those pathogens like strep mutans, which help to produce a lot of acids, make the tooth more prone to breaking down, and will drive the development of cavities, right? Arginine actually supports the commensals, the good bacteria, and it leads to a more basic environment. So the tooth is less prone to breakdown because the bacteria are not generating all these acids. And so it's a completely different mechanism than fluoride. And you can imagine how the two of them work very well together by keeping the good bacteria at high levels and getting the bad ones at very low levels, and then also strengthening the tooth. But we do find that either one alone can work very well. And in fact, besides the 9-center study we're looking to do a pediatric safety study, because since arginine is naturally in a mother's breast milk and baby bottle formula, it actually helps with neurological development, but it helps to prevent caries. We could be applying this 6 months old into a child's mouth to really drive prevention. So that's very exciting. To think about that from the time the first tooth erupts, we can have some impact on trying to reduce the risk for developing cavities. Very exciting stuff.
There's also a nutritional implication here, right? Protein foods, which would be high in arginine, potentially could be introduced into the baby's diet at appropriate times so that there becomes this increase of these good bacteria, the commensals versus the pathogens that are causing decay. And it's so interesting. So how long has Colgate been working on this? And do you think that you will be the lead player of this to create this unique value proposition for the consumers? Or do you think everybody else is going to jump on the bandwagon and we're going to have that beautiful competition occurring between the marketing powers of the oral health and the oral care companies?
Yeah, we've been working on this for 15 years since we licensed the technology from Stony Brook University, where I actually came from. And Colgate has done an awesome job of developing this technology, not only for caries, but for sensitivity. It was first introduced into the market for sensitivity. And in fact, there is a product in the U.S. market for sensitivity, Tom's Instant Relief, which is 8% arginine. And so, it is approved for sensitivity, and we look forward to the approval in the U.S. and other parts of the world for caries prevention as well. We have used it in the past as in addition to fluoride, but never as a standalone. And so that these studies that we have done looking at arginine as a standalone really prove that it in and of itself is a preventive agent. And, it's interesting what you say, Jonathan, in the diet, et cetera, you can consume arginine. And there have been studies done looking at chews, candies with arginine in it to help prevent caries in young people. And I think that Colgate will be the leader because we have put the most time, effort, and work into it. and are doing the hard studies that need to be done. And I give the company credit, and I really appreciate working at a company that's willing to invest what it takes to drive this forward. But I do believe, Jonathan, down the road, it will be like fluoride. Everyone will accept that this is a new agent, right? So there'll be others who will join us in trying to prevent caries across the world. So I think it's very exciting to be taking the lead in this.
And also you have an active that doesn't have the potential so-called, let's call it public-facing side effects that fluoride is garnishing from a standpoint of what's out in the consumer world. Whether it's true or false, perception is 9/10 of the law here, and people perceive that fluoride has a negative impact at certain levels. Could you comment on that, and how does Colgate educate the consumer to the good side of fluoride? Because as a professional, we deeply understand the mode of actions, how it works both in uptake in the developing tooth to create that fluorapatite molecule, and also topically, as you were describing, to create that improved surface on the tooth. But how does Colgate think about that messaging, that important messaging to the consumer, so that you can dispel the myths out into the market?
Yes. I mean, fluoride, as we know, is very safe, used in toothpaste. It's also very highly regulated by the regulatory agencies. And so, of course, we comply with all of that. And so we know it works. We know that it's safe. We share the information with people. But as you say, unfortunately, it's probably one of the biggest issues we face in science is misinformation going out. And unfortunately, we do see a growing market of people using fluoride-free products, which increases the risk for what we talked about in the beginning with Maria, which is the incidence of disease will rise, right? And there are some countries in the world where 50% of the market is fluoride-free, like China, where we did the study with arginine. And so I think it's really important that people have choice, right? But certainly fluoride, it's very safe. I mean, think of the millions and millions and millions of people who are using fluoride toothpaste all over the world. And it is very effective. But now we have another tool. And I think, we can make it even more effective by adding it in. And for those people, for whatever reason, who choose to take the fluoride-free route, which we know does absolutely nothing for caries. I mean, there are many, many papers written. So if anybody thinks you're using a fluoride-free toothpaste and it's taking care of your caries, you're wrong. Those studies have been done. But now we may have a new tool. So we have a new active that can help if you chose not to use fluoride. So I think that this addresses a potential and a looming public health issue as the numbers of people who use fluoride-free products does grow, and it gives them another option. But you are right, Jonathan. We need to continue to educate people about the fact that fluoride is very safe.
Yeah, and I do want to make sure that for those listeners on the podcast today, for those parents whose kids are being offered silver diamond fluoride as a anti-caries treatment, that there's appropriate consent and there's appropriate conversation, because there are different tools for different parts of the mouth or the tooth structure. And so if you're using STF for the front teeth of the child and there's some staining down the road, you don't want to be surprised, right? So there's efficacy, there's appropriate use of the right tool in the appropriate situation. And I think that's what, Maria, you're getting at, is that innovation needs to be in that specific part, big market, big opportunity for caries. Let's make sure that we have an abundance of different treatment options or prevention options in this case. And that's amazing. That's the power of innovation here. So have a conversation with your dentist about all the available options. the piece that I really appreciate about this conversation, in addition to the richness of the science behind it, is the opportunity, Maria, to take this new technology and this new potential product, and the fact that arginine is in the mother's breast milk and in certain foods opens up a conversation where the dental team is now part of the pediatric team, or the OBGYN, or for pregnant moms or new moms who just had their first baby, to have the conversation around oral health with their pediatrician. So in this future state where you have a product on the market that's with proven efficacy and it's ready to be launched, what is the dream optimal model of care delivery between the medical teams and the dental teams, in your view?
Well, I think, obviously your mouth is connected to the rest of the body. And, we have known for many, many years that the infection and inflammation in the oral cavity can have an impact on the rest of the body. And so, for many years, I was involved in doing research in a general clinical research center at Stony Brook, where we looked at the impact of oral health on people with diabetes, on risk for cardiovascular disease, on adverse pregnancy outcomes, respiratory diseases. There's so many where we know that oral health is so important to overall health and well-being. But, having gone to dental school like Jonathan and in a school where we went with the medical school, there's a recognition that the physicians and other healthcare providers do not get a lot of education about oral health. And so it's very important that we share the data, the knowledge about the connections between oral health with overall health. And so, in working in this DCRC, it was really interesting to see that when you work side by side with other clinicians, that is knowledge that we share and then begin to work together on. And so you're starting to see dentistry, coming closer with primary care, being provided in FQHCs, federally qualified health centers. And that kind of connection, I think, is very important for us to work together. And one of the people that I worked very closely with at that time, a guy named Jerry Quirk, who was the head of obstetrics and gynecology, wrote the first basically position paper in the state of New York, telling obstetricians that it was important that their patients have good oral health, and that poor oral health could have an adverse effect on their pregnancy, on the birth of their child, and that dentists needed to provide care to people who had, periodontal disease, even during pregnancy, and that, waiting till the end was not the answer. So those types of connections drive the sharing of knowledge and getting it out into the communities. And so I'm happy to see it's happening more than it did in the past, but it is important that we work very closely together. The other reason we put our dental chairs in the middle of a hospital to do this research is that we noticed that even getting people to leave from the physician's office and come to the dental office, they didn't often make the trip. So if we were next door, they came. So I think, putting us together is a very good thing. And I think that when you look at the overall health of people, working together to improve on health is essential. And so I'm happy to see a bit more of it in our communities. And certainly I know in the dental profession, we reach out to our medical colleagues all the time. And now with some of the EDC that we're seeing that is joint, where you actually have medical and dental information in electronic data capture so we can communicate even more easily, I think that's very important too, because you can start to see the impact of the care we give in the dentist office on, medical parameters and dental parameters. And the physician can see this as well. So I think that's going to only facilitate this more. So I'm giving a talk down at Nova University where it's all, they're talking about medical dental integration, which I think is a new area for us. But if you think about it, it may be new today, but years ago, dentistry was like a subspecialty in medicine. And so it was, at a certain point in time where we kind of became separate, but we're not separate because we were there to begin with, because it's part of your overall health.
Maria, we love to talk about Mariano's book, and she talks about the mouth is connected to the rest of the body, and 58 systemic inflammatory diseases are connected to inflammation in the mouth, as we know. And there's this new division of oral systemic medicine that you're describing. So if we took a snapshot and we said today, where are we today? The truth is that the physicians don't really know what to look for in a patient's mouth. If you ask the physician, what do you look for? He says, I look for some redness. And if you ask the dentist, what are you looking at? Are you looking at blood pressure? You're looking at A1C? You're looking at pulse ox? What are you looking at? No dental office is really doing that, right? So where do we start? You mentioned Nova University. I'm a big fan of Nova and their dedication to innovation and unbelievable education. Head of prosthodontics, Alexander Bendayan down there is amazing.
Plastic leaders, yeah.
But doesn't it start in the dental school? Isn't this concept of oral systemic medicine needs to be a division in the medical and dental schools? If they learn the same thing. I went to Boston University. I was very fortunate. First 2 years we were in medical school. Harvard, the only dental school in the country that integrates dentistry and medicine all under one roof. Dental school is part of medical school. And I don't want to go back to 1840 and the old grand rebuke when the physician said, no, you cannot join our medical school. You have to open up your own dental school. That was 1840. Here we are, in 2024. Not much has changed. But a company like Colgate, the global impact of Colgate, what you all can do to start a bit of a revolution here. How do we get this oral systemic health medicine knowledge? It's 20 years out since the silent killer was on the cover of Time magazine by the Surgeon General of Satcher at that time. How do we change this 20 years later when the oral health, it came out the report, and you know what? It was thicker, but it was the same conversation from 20 years earlier. How this change has to be coming for this. How do we?
Yeah, I think, one of the things is breaking down silos, right? So really to make progress, we recognize you have to have academia and industry and government and the profession and the researchers all working together instead of their own little silos. I think a lot of people are trying to make progress, but we are trying to do it individually in various sectors, right? And certainly I agree with you, Jonathan. I was 20 years in academia that, you need to start in the academic setting. But to be quite frank, unless reimbursement really pushes some of this forward, we're not going to see that. And I will tell you, at Colgate, we are working with insurance carriers to do the hard work to show that the investment in oral health will show dividends, not only in improving on the oral health of someone, but also on the medical side of it, right? And many insurance carriers have both sides. They have both the dental and the medical, and they can clearly see the impact of people actually using their dental insurance when they have it, and sometimes they don't use it for various reasons, or giving them dental insurance when they didn't have it before and they felt that they couldn't get the care that they needed. So I think that, that's a very important part of it, is the reimbursement side. And that goes the other way, too, for the medical side. I have met with when I was in academia, with insurance carriers who were reimbursing dentists for taking blood pressure, for doing BMIs, for looking at blood glucose levels, because we can screen for these diseases where they may be missed and get people in earlier, which is going to save money as well. So it goes both ways, right? But I think that, we all have to work together in order to make that work. But I have to tell you, I gave a talk at a global oral health conference down in Merida, Mexico, and I had the good fortune of meeting Steve Beshear, who was the former governor of Kentucky. And he made significant changes in access to health care and including dental care in his state of Kentucky. And the only way that he was able to actually change laws and get things integrated was to give the economic rationale for it. So he said, you all sound very frustrated. You have all this data, but nothing's happening. So how do you make it happen? And so Steve said, work with Deloitte, work with these people who can help you to really put the data together for the economic argument. So at Colgate, we joined the World Economic Forum, and I sit on the Global Health Equity Network, which is within the World Economic Forum. And we actually created an oral health affinity because oral health was being left out of the discussion as usual, right? And so they had actually put together a plan for companies for a zero health gaps pledge to have CEOs of companies sign that they were, taking care of their employees' health and concerned about the health of the communities that they, serve. And when you looked at the Zero Health Gaps Pledge, there was nothing in it about oral health. The plan, the pledge, the whole thing. So I said, where's oral health? And they said, you know what? We forgot. So I said, let's create a oral health affinity group. And to their credit, the WEF allowed us to create this group. And we have a white paper coming out. Marco Hujisuk from the ADA is the primary author on it. And we have brought together all of the data that supports that if you improve on oral health, if you have preventive strategies, that it is helpful to not only the economics of your company, but to the world's economy. When you look at missed days of work, missed days of school for kids where their parents have to take off of work to take care of them, all for oral health issues. And so I think that, that was an awakening for me, is that we can have all this data and all this interest, but without the economic argument, we're not getting very far. So we're now continuing to promote that.
I love it. Maria, you come from this healthcare insurance background, this whole concept of a wellness model versus a sickness model, proving it economically to the insurance companies that are driving a lot of the decision making. Would you weigh in on this from a healthcare perspective?
I love it. This is the topic that's near and dear to my heart as well. And I've been saying this for in quite a few forums now, including an article in Forbes that came out that said oral health is the missing piece in healthcare. Because I believe that in healthcare, we have been calculating total cost of care wrong, because we haven't been factoring in the cost on the dental side and how what we do or fail to do on the dental side impacts our medical cost, right? The number of preterm births that we would have. And we know that a single preterm birth, the cost of mom and baby to get out of the NICU is $750,000, a single preterm labor. And so to me, there is this misconception around dental is what you do for the oral health, and then medical is what you do for total cost of care. And that's the first bias. And Maria, we can't, emphasize what you're describing enough, because the famous quote by Howard Schultz that Starbucks spends more money on healthcare than on coffee beans just puts in perspective how important healthcare costs are for the bottom line of the businesses, right? And you pick any of the largest employers like Walmart, they spend $2 billion to take care of their employees and their dependents. These are not insignificant amounts. And clinically, scientists like both of you have proven that there is a credible connection between oral health and overall health. The business model and the way we deliver care needs to catch up to the science.
Right.
Yeah. I'm so incredibly grateful to have you, Maria, working on this at the highest possible levels, influencing the decision makers. Because the other myth I would like to disperse is this conversation we're having is not a conversation for the clinicians or conversation for the scientists. It's a C-suite conversation. It's a conversation for the business leaders, right? Because that becomes a business conversation, not only about your bottom line, but how are you differentiating yourself as an employer relative to other employers? What are your benefits? How do you take care of your own employees? And so that's the conversation I think we need to have, rather than to say, oh, do you have 3 cleanings a year or 4 cleanings a year? And, dental benefits are just the thing that you put in the bottom of the footnote. So that's why this is near and dear to my heart. I also, the one thing that I would put in here is, I think this conversation has been so amazingly insightful, but also not for so many levels, but also we were all able to elevate the importance of treating caries, because untreated caries, oral health is one of the only areas where by the time you feel pain, it's too late, right? Yeah. And so you could have very significant adverse outcomes from untreated caries. I mean, just recently we saw an NFL player, 36-year-old NFL player who died because he had infection in the mouth, multiple caries, roots that were untreated and then were left in, and he had an adverse, somebody died. And so one of the things that I would love to also disperse as a myth is the fact that, when you have time to deal with your caries, that's not acceptable, right? We still have to think about that prevention. What a great way to wrap it up. What a great way to maybe, actually, I should say, begin the conversation. Maria, we're hoping that, number one, you share with us amazing resources, some of the things that you were referring to about publications and articles. When the white paper with Marko Vujicic and your team for the World Economic Forum is available, please let us know. I would like to share and with our audience, and would like to have you back. Absolutely. So
I'd love to. Yeah, I think educating the public about oral health is very important. I think we've tried to do things from the top down, but we need advocates through the consumers and the people. And the more they understand it, the more they can advocate. And there's a lot more of them than there are of us, right? And so we have a program called Know Your OQ, Know Your Oral Health Quotient, which is educating people about oral health, like, your IQ or EQ. What do you know about oral health? And it's like 10 quick questions. And to be quite frank, Maria, we've learned that some people don't even know that caries or cavities is a disease. So like the football player probably didn't think, well, what do I have to take care of this for? So if you don't know it's a disease, you're going to have issues, right? And so we have to educate people about these connections between their oral health and their overall health. So I think, that's very important as well. And being part of Colgate, we have the opportunity, being in 60% of all homes, to actually educate people about it, which is very exciting.
Absolutely. Great to have you on the show. Think Oral Health is to raise the awareness, and having people like you sharing your experiences, your wisdom, and really the vision of where Colgate is having a huge impact. It's been really great for our listener. I know it. Thank you so much, Maria.
Thank you. Thank you. Thank you for having me.